Hi everybody, welcome again to Dr. Manny's YouTube Learnshops, and today we'll be reviewing body systems. Now the learning outcomes for this is on the completion of this asynchronous presentation, you as participants should be able to 1. Define anatomy and physiology, understand some of the divisions of the human body, name the various organ systems, comprehend some of the selected pathophysiology that's presented, and appreciate the role of homeostasis. So what are some of the definitions? Anatomy is defined as the study of the body and physical relationships between the body systems. Physiology is how it works. So this is the study of how the systems of the body work together or individually. Pathophysiology or pathology is the study of abnormalities or anomalies that cause illness. So when we look at the human body, it's organized. It's organized via certain features, which typically involve cells. Cells together create tissues. Tissues together create organs. And organs together create systems. When we look at initially the organization of the human body, you look at chemicals. And really, they're atoms. And atoms are all living and non-living matter. These can be solid, liquid, or a gas. Atoms combine to form molecules. And there are so many different molecules in the body. Elements are defined as the fundamental units of matter. And 96% of the body is made up primarily of 4 elements: carbon, oxygen, hydrogen, and nitrogen. When we take it a step further, atoms create cells in combination. And cells are really the smallest independent unit of all living matter. And there are trillions of them within the body. And they can be distinguished by their characteristics such as size, shape, and their structure. And every cell has got a specialized function that contributes to special body needs. As indicated in the diagram, you can have bone cells, blood cells, muscle cells, fat, skin, nerve, endothelial, sex or reproductive, pancreatic, cancer, stem, and more. If we take it a step further, cells are organized into tissues. And tissues are cells that are bound or held together. And they create the tissue. And there are primarily 4 types of tissues, which are epithelial, connective, muscle, and nervous. And they all have specialized functions. When we look at organs, which are made up of different types of tissue, they've evolved to carry out specific tasks. So for example, in the gastrointestinal system, stomach. And it has numerous types of tissues that help it function. If you look at the heart is comprised of cells and tissues to help it function. There are primarily 3 types of muscle cells, which are cardiac, skeletal, and smooth. And all are different. For example, skeletal muscle is voluntary. You can control it. Smooth muscle in the bowel, you can't control. Cardiac muscle, you can't control. Some people say that you can through meditation, but typically here it's an involuntary muscle. It does its own thing. It has the property of automaticity. Skeletal muscles are in your arms, legs, neck, etc. You can control those. Then tissues are organised into systems. And systems primarily consist of a number of organs that carry out a common function or a coordinated set of functions. And they can work independently to carry out a specific function for health requirements and survival and needs of the body, or they can work as a team. The human body, the overview. It's a highly technical and complicated machine. Amazing. Amazing what God created, really. And we as human beings, we don't appreciate it. And we abuse it in most cases. It's made up of a number of systems that work independently. So body systems coordinate and integrate with one another to ensure our survival as an individual. And should one system fail, the consequences are possibly likely to extend into other systems unless the body can help itself. So the body essentially is a very complex system, both in structure and function. Absolutely amazing. And as I said, human beings tend not to appreciate it and tend to abuse it. And then they get sick. What are some of the body systems? Well, we have the musculoskeletal system, the cardiovascular system, the respiratory system, nervous, digestive, integumentary, endocrine, genitourinary, and reproductive. When we look at the musculoskeletal system, this consists of muscles, bones, tendons, ligaments, and joints. And what does it do? It permits body movement, provides body support and protection, maintains your posture. Muscles produce heat, it keeps us warm. Bones produce blood cells in the bone marrow. And it stores minerals and more. I've just given you some of the major functions. What happens when things go wrong? In the musculoskeletal system, the selected pathology can be fractures, dislocations, crush injuries, and amputations. Fractures, breaks, broken bones. They can be open, as this one is, or they can be closed. Typically, diagnosis is on an X-ray. Here we've got leg, closed, and you can see fractured femur and fractured tibia and fibula on X-ray. Then you've got dislocations. Dislocations just mean disjointed, malaligned. Crush injuries, well, explains itself. You've crushed whatever body part that you've got. This could be superficial or it could be deep. Minor or major. Then you've got amputations, which can be partial or complete. I'll let you use your imagination to decide whether this is complete or partial. Amputations. If by chance they're complete and still in good condition, a good thing would be to preserve it and transfer it to the hospital with the patient, so that possibly it could be reattached. Typically put into ice water to keep it cold, to prevent it deteriorating. Partial. Then we come to the cardiovascular system. And the cardiovascular system consists of the heart and its associated blood vessels. And the purpose of the heart primarily is to pump blood. It's a pump. It's got other functions as well, but primarily it's a heart pump. And it pumps blood into the blood vessels that supply blood to the essential parts of the body. What's its purpose? To transport gases, nutrients, wastes, hormones, and it protects the body from fluid loss. It's also important to regulate body temperature. When you're too hot, blood vessels vasodilate. When you're too cold, blood vessels vasoconstrict. When you need more blood, heart pumps up, increases heart rate. When you don't need so much when you're sleeping, it slows down, controlled by the sympathetic and parasympathetic nervous system. Heart, an absolutely amazing organ, like most of our organs within the body. Can you live without your heart? Absolutely not. Let's look at some of the selected cardiovascular pathology that can occur in a human being. You can have a heart attack, but essentially it's a lay term to say that you've got a cardiac problem. You can have an acute myocardial infarction, which this man's experiencing. You can have injuries that result in pericardial effusion, as you can see here, where the pericardium, which is the covering that surrounds the heart, is full of fluid. This could be a tamponade or it could be an effusion, and it results in cardiac dysfunction. You can have vascular disruption as a result of now an aneurysm, which can be thoracic or abdominal, and if it ruptures, you can die as a result of acute hemorrhage. You can have severe shock as a result of a traumatic injury. Here's an amputation that is absolutely complete. Possibly a farmer who got his leg caught in some sort of grinding machinery or harvesting machinery. Wow. Then we have the respiratory system. And the respiratory system basically consists of the nasal cavity, the oral cavity, which contains the pharynx, the trachea, your windpipe, your lungs, bronchioles, alveoli, and they're essentially concerned with the movement of gas or respiratory gases in and out of your lungs, because we all need oxygen to survive, and we all need carbon dioxide to be removed. The functions of the respiratory system basically are to draw oxygen from the atmosphere into the body and then to excrete carbon dioxide from the body. Its purpose is to supply oxygen to the blood, and it helps regulate acid-base balance, which is part of the homeostatic process, which we'll be reviewing later. If you don't get oxygen, you become hypoxic and you can become quite ill and possibly die. If you can't remove CO2, carbon dioxide, you will die eventually. Air goes in, air goes out. This is what we call breathing. Breathing or ventilation is the movement of air into the lungs for gas exchange and out for CO2 removal. Selected pathophysiology in relation to the respiratory system is asthma. Asthma is where the airways constrict and air can't get in and out. Allergic reactions can cause breathing difficulties as well. Blunt chest injury, like this person with a seatbelt injury. And even though you can't see the contusion of the lung can be severely injured. A penetrating chest injury, which is quite obvious. Or a foreign body airway obstruction. Here, there's an example of foreign body airway obstruction where something is lodged within the trachea. Now let's look at the nervous system. And the nervous system consists of the brain, the spinal cord, and the peripheral nerves. And the central nervous system, as it says, central, deals with the brain and the spinal cord. The peripheral nervous system deals with the cranial nerves and the spinal nerves. And their functions are to detect and respond to any changes in the internal or external environment. And this enables higher order mentality and reasoning, thinking, memory, and your computer, your brain, and the connections regulate all body activities. If we look at some of the selected nervous system pathology, we're looking at fainting, or this could be stroke. This could be stroke as well. This definitely is stroke. As is this. It could be seizures, which could be tonic or clonic, or tonic and clonic. Or it could be related to head, neck, or spinal injuries. As a result of a motor vehicle accident, for example. The digestive system is next. And this consists of the oral cavity, the salivary glands, the pharynx, esophagus, stomach, small and large intestines, and accessory organs such as the liver, pancreas, and gallbladder. And their function is to break down food. And this occurs mechanically and chemically. And then, after you've broken down the food and what the body wants has been absorbed, it eliminates undigested wastes, excretion, in the form of feces. But, most importantly, it absorbs all required nutrients. If it doesn't need it, it will eliminate it. In the mouth, you've got mechanical breakdown. In the stomach, you've got chemical breakdown. The anus is the exit point for your waste products. Let's look at some of the selected pathophysiology for the digestive system. Blunt trauma, which results in bleeding internally. This is called Cullen's sign, where the bleeding becomes exposed and you get ecchymosis, which is the yellow discoloration as the hemoglobin from the blood breaks down. I mean, you could even get it from a chest injury and combined with an abdominal injury from your seatbelt. The lap seatbelt or the shoulder seatbelt, combination of both. Then you've got penetrating trauma. The integumentary system is next. And the integumentary system consists of more than just the skin, but we're just going to be looking at the skin. The integumentary system consists of skin, hair, and your nails, your fingernails and your toenails, your hair on your head and your body. But the integumentary system, when it comes to the skin, consists of two upper layers called the dermis and the epidermis. And essentially, the function of the integumentary system is to protect you from the external environment. It helps with temperature regulation. It helps to eliminate waste, sweat, salt. It receives stimuli from the outside, which again tells you about pain, heat, cold, and anything related to touch. The face has got a lot of sensory perceptors, very sensitive area. What's some of the pathology, selected pathology, that's related to the integumentary system? Well, you can have burns, thermal injuries, which can be severe or mild, as scalds. You can have burns of the 1st degree, 2nd degree, or 3rd degree. Then you can have wounds, and wounds consist of incisions, lacerations, abrasions, contusions, or punctures. Okay, what happens if things go wrong? Pathophysiology or pathology in the endocrine system. There are many, but I'm only going to focus on one, which is diabetes mellitus, because that's one of the more common ones, which again some of you may have or be aware of. And diabetes mellitus can result in a hyperglycemia, or it can result in a hypoglycemia. Symptoms of hyperglycemia, too much sugar in the blood, can be a dry mouth, you're thirsty all the time, fatigue or weakness, you can have a headache, you can have blurred vision, and you have polyuria. You're going to the toilet frequently to pass urine. If you have diabetes mellitus, type 1, you're going to require insulin therapy. If you have too much insulin, this can result in hypoglycemia, or if you don't eat sufficiently. And this can result in fatigue and sleepiness, sweating, pallor, lack of coordination, being hungry all the time, and irritability. If you do collapse or faint, it's cautious that you probably don't administer fluid, because the person may not be able to protect their airway if they're semi-conscious. But it may be as a result of dehydration, because you're polyuric. If we look at the urinary system next, this consists of the kidneys, the ureters, the bladder, and the urethra. And the functions of the urinary system are to remove waste products, such as excess water, urea, creatinine and uric acid. And the urinary system forms urine and eliminates it from the body. It regulates electrolytes and water balance. It helps maintain acid-base balance, and it helps to regulate the production of red blood cells because it releases a hormone or a protein called erythropoietin. And it's the function of erythropoietin to go to the bone marrow and increase the production of red blood cells. If things go wrong in the urinary system, I'm only focusing on a few. You can get a urinary tract infection, a UTI, or in the severest case, you can go into renal failure. If you get a urinary tract infection, typically you'll have a burning sensation, dysuria, on passing urine. You want to urge, or you have the urge, to pass urine frequently. If you look at your urine, it's not clear. It will typically be cloudy and it will have a foul odour, an unpleasant odour. If you go into renal failure, well, you're going to need to have renal dialysis. And this machine takes over the function of your kidneys. There can be two types. This one is hemodialysis, which is now connected to the cardiovascular system, and this one is peritoneal dialysis, where the catheter goes into your abdomen. Next we have the reproductive system, and the reproductive system consists of the ovaries, uterus, fallopian tubes and the vagina for the female, and the testes, the seminal vesicles and the penis for the male. And primarily the function is to produce gametes or sperm in the male and ovum in the female. And it's important to store and transport these gametes, and it also aids in the production of sex hormones. Testosterone, estrogen, progesterone. Well, what happens when things go wrong in the reproductive system? And there are numerous. I'm just only going to focus on a few. Well, first of all, in the female, you can get fibroids, which can be benign or they can be malignant. It can result in fallopian tube anomalies, which can result in incorrect placement of the ovum during conception. It can result in numerous conditions such as endometriosis. Then you've got the male, who can have prostate cancer, or you can have enlargement of the prostate gland, benign prostatic enlargement. However, this can be benign or malignant, and there can also be urethral abnormalities, such as hypostadius and epispadias, which are congenital anomalies. So putting it all together, you've got the internal environment, which is inside the body, and you've got the external environment, which is outside the body. When it comes to the alimentary tract or the gastrointestinal system or the digestive system, water and food go in. Anything that the body doesn't want is excreted as feces. When it comes to the kidneys excrete excessive water and waste products such as urea, creatinine, uric acid. The lungs, they breathe in oxygen and they breathe out carbon dioxide. The skin essentially is your protective barrier against dehydration and germs, bacteria, viruses. If we look at the internal environment, more specifically, you can see body cells. And if we look at the internal, you can see in the lungs, you have the alveoli, and you have the alveolar capillaries, which is where gas exchange occurs. Oxygen goes out of the alveolus, which you breathe in, and diffuses into the blood. CO2, carbon dioxide, which is high in the blood, diffuses into the alveolus, which is low in carbon dioxide, and you breathe it out. Then you have the kidneys. The kidneys' functional unit is the nephron, and it's the nephron that now cleans your blood. It allows urine to be formed, and this is what you will eventually pass from your bladder, your urinary bladder, when you go to the toilet. Then you've got the gastrointestinal system, which now takes food in and eliminates waste. All these systems work together, which is called homeostasis. The body is working in balance. So body systems adjust the internal environment to maintain a stable and constant condition. Any changes that occur within the body, and they do constantly, are kept within narrow limits which are still considered to be normal. However, when this balance is not maintained, you get sick and you can die. And in homeostasis, you typically have what is called a feedback loop. And it basically means that if something's wrong, so for example, let's just say you're not breathing properly and the CO2 rises, this is detected in the brain, and the brain says, oh my God, the CO2 is rising. We better do something about it. So what happens is, feedback mechanism says, start breathing faster. So you start breathing faster, and you eliminate more CO2. Once the CO2 in the blood level becomes normal, the brain says, okay, well, we can relax now. So start breathing not so quickly. So your breathing slows down. Because the CO2 in the blood is normal. This is homeostasis for the respiratory system. Examples of homeostasis can be body temperature. Look at the limit. It's very narrow, between 36 to 37.5 degrees centigrade. If it becomes too high, homeostatic mechanisms occur to reduce body temperature. Or if you become hypothermic, body mechanisms occur to increase your body temperature. Pulse rate, another one. If the heart rate drops below 60, the body will try and increase the heart rate. If it goes above 100, it will try and decrease it. Or if you need the heart rate to become higher, tachycardia because you're exercising, the heart rate will go up. These are called our vital signs. Vital signs are signs that tell you about things that are dangerous within the body. Hypothermia, hypothermia, body temperature, dangerous. You want normothermia, between 36 and 37.5 degrees centigrade. Pulse rate, bradycardia, slow, tachycardia, fast. You want normocardia, between 60 and 100, very narrow range. Respiratory rate, apnea, you stop breathing. Bradypnea, less than 10. Tachypnea, greater than 20. Very narrow range. Blood pressure, hypertension, hypotension. You want normotension. Pain. Well, typically you don't have pain. If you do have pain, there's a range depending on the scale you use. Let's just use the numerical, 0 to 10. 10 is the worst possible pain you could possibly have, 0, no pain. SpO2, the peripheral saturation of oxygen. Typically, look at the range, 95 to 100%. Less than 90, hypoxia. Greater than 100%, hyperoxia. These all are associated with homeostasis. Homeostasis is the mechanism that keeps the body within normal limits. Now remember, vital signs are different depending on your age group as well. So if you're very young, you were just born, they'll be different compared to if you're very old, a geriatric. Pediatric, geriatric, different. So, other examples could be homeostasis, the body in balance, can be electrolytes. Sodium, potassium, calcium chloride, magnesium, etc. They all have to be within a normal range. Arterial blood gases, the pH. Look at the range, very narrow, 7.35 to 7.45. Blood glucose, less than 3.6, you're hypoglycemic. Greater than 5.8, you're hypoglycemic. Oxygen. If you're looking at arterial blood gases, your what they call the partial pressure of oxygen in the blood, the PaO2, is typically between 80 and 100 at room air. Anything less than 80, you're hypoxic. Anything greater than 100, hyperoxic. Carbon dioxide, CO2, look at the range, very, very, very narrow. If it's less than 35, you're breathing too quickly. If you've got a range of greater than 45, you're not breathing enough. Hypoventilation, hyperventilation. So, in conclusion, body systems are groups of organs and tissues and cells that work together to maintain homeostasis. Some organs may be part of more than one body system if they serve more than one function. Other organs and tissues serve a purpose in only one body system. All body systems are necessary, however, for a human being to be able to survive and to reproduce. Okay, thanks everybody. As previously, if you found this session worthwhile, check out some of the other Dr. Manny Learnshops on YouTube. Okay, bye for now.